Okay, hi, good afternoon, everyone. My name is Dr. Donald Ang from Island Hospital. I'm one of the cardiologists at Island Hospital here, and my interest is in interventional cardiology. So today I'm going to educate you all about some important factors associated with your heart, and also importantly, how to distinguish pains in the chest, what is important, and when you should seek attention. Okay, so we'll put a slide up on and just go through some slides with you all and some information, and hopefully you'll be educated at the end of this. So my topic today is actually on chest pain. Is it heart attack? Because majority of patients get pains here and there in the chest, but is it something that we should be concerned about? So that's what my lecture today is going to be about. Yeah. Okay, so we'll start with the first slide. Our heart is actually a very important structure. Of course, it pumps every second. Okay, and if the heart stops beating, and therefore there's no blood supply to the brain and to the rest of the body. Okay, and it's incredible in that in your lifetime it will pump close to 2.5 billion times, and that's without you knowing it. It automatically does it for you, such that you can live well. Okay. So it's very incredible in that sense. What I want to emphasize today is on the risk factors that will predict whether someone develops heart disease in the future or whether you have heart disease at present. Okay. By far, the most important factor is diabetes. Okay. If you have diabetes, then there's a very high chance that you may develop blockages in the heart, weakness in the heart muscles, coronary disease. The other second risk factor is that of high blood pressure. Okay, equally important, if you've got high blood pressure, then you have to take your medicines regularly so that the strain on the heart can be lessened. Thirdly, smokers. Okay? Smoking thickens the blood, causes deposition of nicotine in the blood vessels, and is detrimental to the heart vessels. Okay? Fourth is cholesterol issues. If you have high cholesterol or problems with what we call familial related, which means that it's being brought down by your genes, high cholesterol levels, then that should be treated adequately. Okay, because again, it's a risk factor. It's a risk factor. And finally, a family history of what we call premature heart blockages is also very important. For example, if you have an uncle or your father, your mom who develop heart problems in the early 40s or the early 50s, that becomes a very important factor. Okay. Now, just a very brief touch on the arteries of the heart. The arteries, what we call the blood vessels of the heart, is important because it carries blood to the heart to give oxygen to the heart, so that the heart can function properly and it can stay healthy. Okay, that's the function of the arteries of the heart. And you can see this very complex diagram, but essentially what it tells us is that you have three major arteries. Okay, the heart is located on your left side. One major artery that runs in front or on the left side, one major artery that runs behind the left side, and what we call the right coronary artery or the or the artery that supplies the right side of the heart. Okay. When someone describes angina, or what we call chest pain, this is usually a result of the arteries narrowing because there's plaque buildup that results in impairment of the flow of the blood flow in the arteries supplying the heart. And this is a term we call angina or chest pain as a result of insufficient blood supply to your heart. Okay, so if you look at this diagram, this is a normal artery whereby the blood flows very nicely. This is an artery in the heart whereby the flow of blood is a bit obstructed because you can see there's some plaque built up. Okay, this yellow bits here, the plaque built up, the cholesterol built up, and then you have the severe form of built up that causes significant narrowing in the arteries and hence the risk of having angina or heart attacks. Okay. It's very common. People who have problems with heart pains as a result of blockages. It's definitely rarer among women, okay, who are of the younger age, okay, because they are protected by the hormones. But once you go post-menopause, the risk accelerates. The risk of developing heart problems or heart-related blockages accelerates. Okay, as you can see, when you reach the age of 65 to 74 years old, up to 20% of men may describe angina or chest pain associated with blockages. Okay, so now this is very important. Perhaps the most important slide in this brief talk here. What are the symptoms? Okay, so this is gathering all the information that I've seen so many patients, what they describe, and what is the commonest form of description that maybe alerts me that this is likely to be a heart-related chest pain, because the pain here can be anywhere. It can be the lungs, can be the nerves, can be the muscles, could be toothache. Sometimes it can be a wide variety of possibilities. But what gives us the impression that it is heart pain are the features below, and that you have to pay attention to, okay, that you need to seek more urgent attention. So the pain starts in the center. Sometimes people say it's on the left side. It can radiate or spread to the jaw, to the left arm. Okay, it's very rarely a sharp pain or a localized pain. It's usually more spread out or more diffuse, they call it. And the nature of the pain is some kind of tightness or some kind of heaviness in the chest. Okay, remember that. And usually there is a close relationship between exertion. Exertion means when you do something or when you overdo something, it brings on the pain. Okay, the chest pain. That is very important, because if you sit down and do nothing and you get a bit of poking pain here and there, most of the time it is not heart-related pain. But when you do something and you rush and you get some tightness, then please, that is an important type of pain which may suggest that it is coming from the heart. Okay, enough. So that's very important. So in order to address all these issues, make sure you don't smoke. If you have hypertension or blood pressure issues, make sure you control your blood pressure with appropriate medicines. Same with diabetes. Diabetes, you can't help it because it's an inherited condition. But of course, you can take your medicines regularly to make sure that your sugar control is good. Reduce weight. Make sure that your BMI is less than 25. Okay, if you have got high cholesterol, especially if it runs in a family, you may have to take some cholesterol medicines. Okay, exercise more. We don't like physical inactivity. Treadmill 3 times a week for half an hour each session will help a lot. Dietary constraints, which means that more vegetables, fruits, chicken, and fish is okay, but less red meat. Okay, and carbohydrates. Alcohol per se is not a very important factor, but of course, excessive alcohol can result in weakness in the heart muscles. Okay, so not so much to do with the blockages in the heart. Okay, so I'm now going to run through some of the tests that we offer our patients who come in and see me with this sort of pains, so that they are well informed as to what they can expect from a cardiologist like myself in order to diagnose the pain, to see whether it's actually coming from the heart or not. Okay, an ECG, an electrocardiogram, stick some electrodes on the chest, and then we get some nice tracings, and then we will know whether is this in fact something very urgent that needs emergency attention. But per se, the ECG on its own is not very useful unless the symptoms are very severe. Okay, so it is what I tell my patient, the ECG is a very crude assessment. Okay, yeah, so we could still miss a lot of problems if we go by the ECG alone. Okay, the other one is we can step up and ask you to do, if you are quite fit, to do a treadmill testing, do 5 to 10 minutes on the treadmill to see if it provokes any pain in the chest or it causes some changes on the graphics that would alert us that this may be in fact coming from the heart. Okay. Next one is a very important modality, which is an ultrasound of the heart. The ultrasound of the heart is important because we can check out the structure of the heart, how the valves are behaving, the blood flow in the heart, and the sizes of each chamber of the heart. So it is a way of assessing the structure of the heart. Very, very important modality. Okay, this is what we see on the in the echocardiogram or the ultrasound of the heart. Okay, the 4 chambers of the heart and also the valves and etc. Island Hospital has recently invested in a very expensive dual source CT scanner, state-of-the-art CT scanner. As you can see, that's the machine that we have sitting in Island Hospital. And of course, it is important because when we use good scanners, we can visualize the arteries in greater detail. Okay, so this is some of the images that we usually get. Nice images that shows us, all these little branches here are actually your coronary arteries, whereby the blockages take place. So this modality is actually looking into your arteries to see if there are any blockages. So it's an important modality. But of course, the slight downside is that you are exposed to some form of radiation in this situation, although not huge amount of radiation, but it gives us information that are very important with regards to the arteries of the heart. And lastly, what we call the gold standard that we employ is what we call a coronary angiogram, whereby we bring the patient into the cardiac lab, and then we use this small catheters, fit it through your little wrist here, okay, and the catheter sits into the arteries, and we inject some dye into the arteries to have a video or the flow of the blood in your arteries. And this is a gold standard. A gold standard because we can see live the flow of arteries in your heart, and at the same time, if we find that there are severe blockages, we can go ahead and treat them to reduce the risk of subsequent heart attacks. Okay, and these are some of the nice images that we get when we inject into the arteries to look at the arteries of the heart. Okay, the left artery, one above, one below, and one on the right. So a lot of invaluable information from this very good modality. And after the procedure, which takes 20 minutes to half an hour, we apply a little wristband, okay, to prevent blood from coming out the puncture site. For half an hour, we remove the wristband, and after that, you're actually free to go. So it's actually a very straightforward test. Comes with a small risk of 1 in 1,000, okay, because it is the catheter enters your heart. Okay, so some of the common worries that people have after all these tests and they find out they have angina. Okay, so don't worry about straining. Okay, if you have angina or blockages, it doesn't mean that, oh, you cannot strain. No, you can still strain. You can still push yourself hard. Remember, exercises actually physically trains the heart, and it's very important. So you still go ahead with the exercises, but of course, if you get pains, then you may have to stop. Okay, no contraindication to sex life. No restrictions to driving and flying as long as your symptoms are not unstable. Okay, of course, you need to be aware. If you are labeled as having blockages in the heart, a term that you need to know is when the symptoms become unstable, which means that they become more frequent or become more prolonged, that's when you need to seek urgent medical attention. And afterwards, I will go through very briefly one slide about heart attacks. Why are they important? Okay. So the aims of treatment of your condition with regards to the blockages, number one is to prevent recurrences of the symptoms. Number two is to make sure that the blockages do not increase, the blood burden in the arteries do not increase. Okay, and the third and most important bit is to make sure you take good medicines like blood thinners, cholesterol medicines to prevent the risk of any heart attacks. Okay, that's the aim of the treatment. Now, there are in terms of treating, we have got you've got a few medicines that we use to treat. Okay, as we say here, the spray under the tongue sometimes to relieve the pain. We use sometimes when the pain or the angina attack happens, you put a spray down the tongue. It's purely to improve the symptoms. It actually doesn't do anything to the blockage or the artery. Okay, it relaxes the artery, improves the symptoms, but it does nothing to the blockage actually. Okay, so it's more a symptom reliever. This is very important. You may have seen all these aspirin, Plavix, Brilinta medicines that are very important to thin the blood. Why thin the blood? Because if you're left with not much in terms of flow, it's important you keep the flow good by thinning the blood so that it moves nice and well. Okay, so these are some of the medicines. Some of you all with heart sufferers, you may know that these are the medicines that we use quite often: aspirin, Plavix, Brilinta. Statins are very useful for cholesterol deficits. Okay, Lipitor, Crestor, some of the good ones. Beta blockers are a group of drugs like your Concor with the heart-shaped tablets that help to reduce the workload of the heart, the requirement from the heart, and hence reduces the symptoms of angina pain, and also equally is important to relax the heart so that in the longer term it improves the prognosis of this group of patients. Okay, ACE inhibitors traditionally are medicines that we use for blood pressure problems like Ramipril, Coversyl, Zestrol, but in patients with blockages or angina, they have proven benefit on top of their blood pressure lowering effect. Okay, so these are the drugs that or medication that as a cardiologist we tend to prescribe to patients with blockages. Of course, when the blockages are severe such that it is not well controlled on medicines, okay, then we have the non-medication treatment. Okay, now non-medication treatment means things like a heart bypass. Nowadays, the heart bypass or the coronary artery bypass grafting (CABG) is reserved for the very complex forms of coronary disease. Okay, whereby we bypass the narrowings here and we use arteries from above here on the left side, pull it down, or some veins from your leg that are being harvested to bypass the severe blockages. And the reason why in the past 10-20 years the rate of bypass surgeries have reduced is because we are now using a technique called angioplasty or stents, which is my way of interest, whereby we actually put in a wire into the arteries where the blockage is and blow it up open with a balloon and keep it open with a stent or a metal meshwork to keep it nice and open. Okay, this is a lot less invasive. It is identical to how we carry out the angiogram through your wrist earlier on. Okay, through your wrist earlier on, and it just involves an overnight stay. Okay, so most patients prefer this option, not to say prefer this option, but majority of blockages can be overcome with this technique. But a small minority, about 10 to 20% of very severe blockages may still require a bypass surgery. Okay, and this is a coronary stent, very small, 3-4 millimeters in diameter. Okay, put into your vessel here to keep it patent and keep it open. Okay, so my final briefing is actually, I'll keep it short so that if you have questions, then we can go through the questions. Yeah, it's probably more important. Okay, this is just a rough guide as to how we should be mindful about symptoms, okay, of your heart symptoms. So heart attack, when a heart attack happens, it is different from angina because it involves an acute or a sudden blockage of the entire artery supplying the heart muscles. This is a rule of thirds. A rule of thirds means a heart attack, of course, by definition, is sudden. Okay, you have no time to prepare for a heart attack because it will hit you just like that, very suddenly. Okay, it's a rule of thirds in that a third of people who sustain a heart attack usually suffer a cardiac arrest at that time, and they may not make it to the hospital. Okay, if you're unlucky, if it's a massive artery whereby the blockage closes off all of a sudden, then the heart will stop beating. Okay, a third of the people will end up in the hospital, okay, and receive appropriate treatment, but sometimes because of the delay or the severity of the heart attack, they may not do very well despite them presenting to the hospital. But a third who sustain a heart attack will have enough time to present to the hospital in time for the cardiologist like myself to open up the artery to put a stent such that the damage done to the heart muscles is minimal and they derive a very good outcome from the procedure. So it is a rule of thirds. It doesn't change much in that because there are still people who suffer a heart attack and the heart stops beating, and there's nothing you can do because it happens in the community. If you're lucky, there's a passerby who can do cardiopulmonary resuscitation, okay, but again, that is quite rare essentially, okay, and therefore it is very important. When a heart artery blocks all of a sudden, it causes very widespread damage, and that's why we want to run these sessions so that the general public are aware of what are the type of symptoms that before you have a heart attack, you should already be seeking attention from the cardiologist. Okay, so these are some of the very, very important markers. Okay, in angina, the pain comes along when you do something heavy. But in a heart attack, it usually strikes you when you're doing nothing and the pain becomes very, very severe, like an elephant sitting on the chest. That's what people describe it as. In angina, the pain, when you stop your exercises or whatever you're doing, it goes away in 5 to 10 minutes. But in a heart attack pain, it is very prolonged. It will last for some time, and you may feel that you are starting to sweat, you feel nauseous, what we call symptoms that are not related to the heart, but you feel nauseous, you are sweaty, clammy, you don't feel well. Okay, you need to come to the hospital as soon as possible. Okay, if you have all these cold sweats and the pain that is not relieved by your usual maneuvers, or when you sit still, it is still there, then please, you have to present early. And the whole reason being, if it's just a simple angina attack, when you stop doing whatever you're doing, it should wear off in a few minutes. But if it's a heart attack, the pain doesn't go off, and you sit on the pain and do nothing, there's a high risk of sudden death. Okay, the heart stops beating and that's it. Okay, so very, very important for us and for you all to understand the differences between a pain that whereby you can say, oh, I'll see the doctor tomorrow, or a pain whereby you say, oh, I really need to present to the emergency department to get some kind of assessment as soon as possible. Okay, so I conclude my brief talk here with a few pointers. Blockages of the heart, or we call coronary artery disease, is very common. Okay, of course, our main aim is to improve the symptoms that the patients are suffering from, and also to prevent the onset of a heart attack, because that is when the prognosis can be very poor when you have a heart attack. If you detect these problems early in a stage and is treated early, you actually live a very, very long life, okay, and you enjoy all the good things in life, okay, because it just means popping in some tablets, making sure that your lifestyle is good. Okay, as I've said, many treatment options. A bypass surgery is like the worst but they are taking medicines, doing an angioplasty, which is a lot less traumatic for the patient. Okay, so there are many treatment options at the present moment. And importantly, please remember, heart attack time is muscle. And the reason why I say this is because if you do see someone with pain, sweatiness, and you bring them to the hospital early with good facilities to get the artery unblocked, okay, you actually save the patient's life. But if the patient sits on the pain, okay, there's a lot of heart damage, and therefore the risk of what we call sudden death is very high. Okay, so I end my talk here, and I leave it to the floor. If you have any questions, you can post it, and I will try to address it one by one. I think you have 15 minutes or so of Q&A session, whereby you can ask maybe whether it's individually related to your experience or someone else's, or is related to this talk. Please fire off your questions, and I'll try to answer them as the best as I can. Yeah, possible. Thank you. Okay, so one of the questions is how to know if the chest pain is serious. Okay, for the floor, chest pain is, as I said earlier on, if it happens suddenly when you are doing nothing, and especially if it's associated with the feeling of nausea, cold sweats, okay, please come as soon as possible. For the less urgent type of pains, if you find that when you overdo, when you exert yourself too much, and a pain or a tightness come along, which means that there is an exertional component, also you need attention, but of course not there and then. Okay, you must arrange for an assessment of your heart arteries and everything, okay, by means of stress tests or the modalities that we have described earlier on. Okay. Okay, the question is, do all heart attacks have the same symptoms? The answer is probably not, okay, but majority of the symptoms would be centered around the chest area and center of the chest on the left side. Sometimes it may radiate to your left arm. Okay, now let me just digress a bit and tell you a little story. Some time ago, a 70-year-old gentleman came to see me with a massive heart attack, and he made it in time to the emergency department with very typical symptoms of heaviness, sweatiness, and we brought him to the lab. He had a huge blockage in the artery. We took out all the clots, put in a stent. He stayed in the hospital for 3 days. He was discharged subsequent on day four, and he did very well, in fact. Okay, he then subsequently came back to my clinic for review 1 week after the angioplasty procedure for the heart attack. Okay, and he walks to my clinic and tells me, "I'm doing very well, Dr. Donald." Okay, and very funnily, I've been having this nagging pain intermittently on my left arm for the past 2 years. In fact, past 1 to 2 years, he said. But interestingly, after you have done the procedure for my heart attack, I no longer feel this pain anymore. And I've sought, attention from numerous orthopedic surgeons, and they've given me some injections, some medication, topical, and some medicine to take. But it comes and goes; it's never gone away. But since you have done that procedure for my heart, the pain is gone. So the pain which he had, the numb and also the dull feeling on the left arm, was actually heart pain, was actually what we call an angina equivalent, or which means that when he was having the heart pain, it was actually a signal to him that he should be seeking attention for his heart. Okay, but again, it's not easy, because if you have a left arm pain, the common sense will tell you go and see a bone doctor or a hand doctor. But what I'm trying to illustrate here is that the symptoms of heart attack is so varied. Okay, we can say that 90% of the time it is centered in the chest, radiating to the left arm or the left side of the chest. But like for that gentleman I discussed earlier on, he could have left arm pain. okay, which was left unnoticed until he came down with a massive heart attack, and he was very lucky to be alive for that, okay. But when we look back, this left arm pain, which was causing him problems, was actually the equivalent of heart pain. Okay, so not all heart attacks pain have the same symptoms. Generally, even a toothache around here, jaw tightness, or heaviness can be heart pain. Okay, any question? Next one. Why do women have different heart attack symptoms from men? Okay, well, women sometimes the symptoms that they describe can be quite different. Yeah, I'm talking about ladies of more advanced age, maybe like 60s or 70s. Sometimes they get a bit of back pain. Sometimes it can be breathlessness. Okay, that means when they do something, they get very breathless. It can be actually not per se as heart attack pain, but I mean pain related to the heart, okay, can sometimes be breathlessness when you do something, for example, or can sometimes be can sometimes be described as back pain, okay, pain around the back, okay, it can still be heart pain. But the thing that we need to be aware of is that when the pain comes on when you do something, please be a bit more cautious and seek quite urgent attention. Okay, the men usually come in with the typical chest heaviness, a bit of left arm pain, heavy feeling. For some reason, males do describe more typical symptoms, but female sometimes the symptoms can be very varied, and that's why we do all these fanciful tests to know if, let's say, indeed we are dealing with heart related issues in this situation. Okay. Okay, the next question is, can exercise and diet help me that I no longer require cholesterol or blood pressure medicines? For the younger folks, that means patients, let's say in their 30s or 40s, yes, you can try dietary modifications or lifestyle advice. I think that's probably the first step. Okay, you may be able to correct the cholesterol levels, reduce the blood pressure by exercising or leading a less stressful life. Um, be mindful that cholesterol levels are only dietary related um, in 20% of the times, which means that 80% of the time the cholesterol is actually produced by the liver. Okay, so if you carry the gene that produces cholesterol, you can diet until you diet and you don't take any fatty food, the cholesterol will remain elevated because you carry the genes, and the liver produces the LDL, okay, that raises the cholesterol. So there's nothing you can do apart from taking a medicine that inhibits or stops the liver from producing all this bad cholesterol. So if you have a condition that is familial or hereditary related, you still need to take medicines. With regards to blood pressure, yes, in the borderline cases, lifestyle can help. But if you have, again, what we call essential hypertension or something that is brought down, your family has it, your father, mother has it, and you developed it, there's no escaping that you need blood pressure medicines. Because ultimately, the last thing you want is poor control of blood pressure, despite all that you're doing lifestyle-wise, and then you end up with complications associated with heart. So it's easier, or it's better, not easier, it's better to pop a pill every day to ensure that the blood pressure is well looked after. Okay? From Tony Belloni, yeah. How do we associate high testosterone level with our heart for male? Oh my goodness, this is a postgraduate question, I would say. Perhaps the best person to answer this is actually an endocrinologist. Testosterone has actually quite different effects on the heart. Okay, uh, so the question was on our heart. Yeah, actually, in fact, there's no clear distinction to say that, if you run a higher testosterone level, therefore you will develop heart disease or things of that nature. But of course, too high or too low testosterone levels can result in some structural changes to the heart. Okay, now excessive testosterone levels can result in things like thickening of the heart muscles, or we call left ventricular hypertrophy. Okay, so of course, if this is the situation, then if it's markedly high, then that should be treated, and that would be on the basis or the advice of the endocrinologist. Okay, but per se, the testosterone level is not one of the markers that we look for when we treat patients with heart blockages or heart problems. But if you do run really high testosterone levels, for example, yes, there is a risk of what we call excessive remodeling in the heart muscles, and that's more related to the structural changes that happens in the heart. Okay, right. So the next question is, if I'm on medication to treat heart disease, does that mean that I'm no longer at risk of a heart attack? Okay, very good question. This question is, in fact, if you are, okay, put it this way, if you are a heart patient, by definition, you are lifelong a heart patient. Okay, there's no escaping. If you have heart blockages in one place and you treat it with a stent, for example, it doesn't mean that it won't recur. It will recur in other places in future if your risk factors are not well looked after. And when I say risk factors, it means that if you don't control your diabetes, you don't eat healthily, or you continue to smoke. Okay, so these are all important risk factors. And once a heart patient, always a heart patient, it also means that you have to be taking medication lifelong. Okay, lifelong medication means some kind of blood thinners. Cholesterol medicines are very important. Okay, sometimes we can advocate take it 3 times a week, then we take it every night. Okay, that's a possibility. And also the individual medicines to control your blood pressure and your diabetes, and so forth. Okay, so no, if you're a heart patient, you have to take your medicines. Okay, and most of the times it is unfortunately a lifelong commitment. Yeah. Yeah, I think this one we have covered it. Yeah, okay, this one is good. Is heart disease an irreversible condition? Heart disease is an irreversible condition once you have sustained a heart attack. Okay, which is why we always want to prevent a heart attack. And the reason being, once you've had a heart attack, usually there is some kind of scarring. Scarring, which means that a particular part of the heart doesn't contract very well, or is slightly weak. So you develop this scarring. And most of the times this scarring may not be reversible. Okay, but if you don't sustain a heart attack, yes, I mean heart attack, heart disease per se is reversible in that it can be controlled. Okay, you can prevent it from worsening. If there are plaque build-ups in the arteries, you take regular cholesterol medicines, the plaque build-up can actually reduce. So there are ways, good medicines that can actually reverse the blockages, essentially. Not entirely, but to control it, and also at the same time reduce what we call the plaque burden. So if you've had a heart attack, no, the condition is not reversible. Okay, except you've had a heart attack, you have to live with it. Maybe some impairment in your heart function, some breathlessness when you walk too far. Okay, that's things that you have to live with it. But there are medicines to help strengthen the heart in the long term. Okay. Is heart disease hereditary? And does it mean that if I have family history of heart disease, I'm sure to get heart problems? Okay, in a way, yes, heart disease is hereditary, which is why it's so important to ask, do you have a family history of what we call premature heart disease? Premature heart disease means that, if you run till you're 70 and 80, you develop some coronary disease, I think it's acceptable because age is a factor. But if you've got young siblings or young parents parents who had heart problems, bypasses at a young age, it is a very, very strong predictor. Strong predictor means that there's a very high chance you will follow the same route. Okay, and therefore, in this group of people, if you fall under this category, you have to be very, very mindful about the smoking habits, the control of diabetes, and high blood pressure. Okay. Yeah. Still go on, or some questions? Yeah. Is salt bad for the heart? Well, salt is not per se bad for the heart, but it is something that you have to reduce if you have got problems like kidney issues, okay, chronic kidney disease, or high blood pressure. Okay. Can stress cause heart disease? Can stress cause heart disease? Stress does not cause heart disease directly, but stress results in excessive hormone called cortisol, and that is actually detrimental to the heart. Okay, it promotes narrowings, causes enlargement of the heart, and thickening of the heart muscles. So stress in the longer term, as an indirect result, can cause problems with the heart. That's true. But directly, everyone has stress. You can't say that, oh, that caused the heart attack, the chest pain. But in very long-term excessive stresses that results in excessive cortisol production would have detrimental effect on the heart indirectly, okay, not as a direct cause. How is heart disease related to strokes? Well, heart disease and strokes are related because if you have blockages in the heart, the blockages do not only choose to take place in your heart, it will also happen in the whole body. Okay, it may block the arteries in the brain and causes a stroke. Okay, in 25% of the cases, strokes are a result of blood clots traveling from the heart into the cerebral circulation or the circulation of the brain. So there is a very direct correlation between heart and strokes. If you are a heart disease sufferer with blockages in the heart, there's a very high chance that you are at a higher chance of a stroke than the general population. Left untreated, okay, I think if heart disease is left untreated, then therefore you will suffer problems with weakness of the heart muscles that ultimately result in limitations in your activities. You walk a bit or you do some activities, you get very breathless. Okay, I think this is the final. Yeah, a glass of red wine a day is good for the heart. Yes, it is good in that it's been proven in Italian diet that a red wine a day or moderate red wine consumption promotes HDL cholesterol. Okay, so good cholesterol goes up. The ratio between a good and a bad cholesterol becomes more evident, and therefore it is protective. Okay, so not to say that you have to drink a glass, but if you happen to be drinking a glass of red wine, it does improve the good bad cholesterol profile, and it would have an indirect benefit to the heart per se. Can exercise really make your heart stronger? Yes, if we have patients with weak heart, not only do we give them medicines to strengthen the heart, but we encourage this group of patients with heart failure to exercise, because when you exercise, whether it is gentle walking on a treadmill or any forms of exercises, rather than sitting down doing nothing, it actually promotes the healing of the heart, because you're actually strengthening it. You're training your heart. Okay, if you sit down and do nothing, the heart will remain weak. But if you work it out day after day, with time, the heart will also start to strengthen. Okay, in addition, of course, to the medicines that we take. So, can exercise make your heart stronger? Yes, especially among the folks with heart failure or weakness in the heart muscles. Okay, this one I'll skip. Okay, so I think that's everything, and I hope that you've actually enjoyed this session and that you feel educated. Okay, and please look after your heart. Do remember to seek attention as we discuss some of the symptoms that are very important that you should really be aware of. The ones, the tightness, the heaviness that is provoked by exertion. Please seek medical attention from a cardiologist. Okay, and thanks for listening. Hope to see you guys next time. Bye bye.